Good morning. Welcome to New Jersey Viewpoint. I'm Shade Bedoranwa. In Middlesex County, homeless veterans are being helped with some very special programs that provide employment, job training, and housing. And we'll have more on that later in this program. But first, esophageal cancer is a silent killer that is very deceptive. If you're someone who suffers from constant heartburn or indigestion, we have some important life-saving information for you today. About 13,900 people in the U.S. will be diagnosed with esophageal cancer this year, and 13,000 will die from it. And joining us in the studio are Dr. Hans Gerdes, a gastroenterologist from Memorial Sloan Kettering Cancer Center, and Dr. Manjeet Bains, a thoracic surgeon specializing in lung and esophageal cancers, and Bart Frazzitta, who was diagnosed with esophageal cancer 4 years ago and is also CEO of Chillington International in New Jersey. Gentlemen, thank you all for joining us this morning. First of all, Doctor, I was so surprised by that statistic. 13,900 are diagnosed this year, and 13,000 people actually die from the disease. Why are so many people dying from it? Is it hard to diagnose?
It is a disease that is often misdiagnosed or missed. Mostly by patients themselves. Unfortunately, the symptoms that are associated with the early signs of esophageal cancer are symptoms that many people experience. Heartburn, occasional pain in the chest, a sensation of regurgitation or food or liquid coming up from the stomach into the throat, or the bad sign, of course, is difficulty swallowing. But most patients who have these symptoms try to treat it themselves. They change their diets, they alter their lifestyles, and they often delay seeing a physician. And when they do eventually see their doctor, it may already be far advanced, and so the chances for cure are significantly reduced.
Yeah, and doctor, if you can just get in here, a lot of people just don't realize that they have this disease until it's too late. Is enough information just not being put out there about this form of cancer?
Partially that's true, but I think as Dr. Gerdes has said, that some of these symptoms are so common and not always indicative of a tumor. By the time the symptoms are difficulty in swallowing, painful swallowing, or other symptoms come which are suggestive of a cancer, usually the cancer is more advanced. The cases that we see, by the time they are diagnosed, more than half of those patients are at a stage when we cannot really consider doing aggressive treatment, which includes surgery, chemotherapy, and radiation therapy.
And you actually were diagnosed with the cancer. When did you find out you had the disease?
In December of '99, had to be in Germany for a business meeting and went to dinner. Took on a piece of steak that didn't go all the way down. When I got back to the States, we checked it out, and doctor told me I had esophageal cancer. I was totally shocked. First of all, to have cancer, but then to hear that I had cancer of the esophagus, which I really didn't think you could ever get.
And did you smoke? Or?
No smoking, didn't drink excessively. Basically, the thought process at the time was what was out there that I could have known about to prevent this from happening, and when I looked at that, there really wasn't anything. So that really led me to Memorial Sloan Kettering and Dr. Bains, who did my surgery, and Dr. Gerdes, who did my endoscopes and EUS, which is a term used for defining the size of the tumor that I had in my esophagus.
And Dr. Gerdes, if we can talk about the different stages of the cancer, when do you realize that you're in an early stage, when are you in a late stage, if you can explain to people out there who don't really know about this disease?
Well, unfortunately, individual patients may not be able to tell whether they are at an early stage or at a later stage. It often requires very sophisticated tests, including endoscopy and CAT scans and endoscopic ultrasound, which Bart Frazzitta just mentioned. Sometimes it requires very sophisticated tests to determine the stage. But what's important is for people to recognize that the symptoms, as Mr. Frazzitta mentioned, he choked on a piece of steak. Sometimes that is the first sign, but often people have other signs. They notice that they have trouble eating. They don't eat as much as they used to be able to eat.
And some people will attribute symptoms to that, oh, we're just getting older, or I've got heartburn, you know, so really making that distinction between, and everyday problem.
That was actually the main cause of what I believe is my esophageal cancer, was chronic heartburn. And by chronic, I'll say 2 to 3 times a week for a good 6-9 month period of time. I believe that really gave rise to the tumor I had.
Yeah,
that's an important point. You brought out the point of heartburn, and heartburn is a very common symptom. As many as 60% of Americans may suffer from heartburn once a year. Now that by itself is not a severe problem. However, there may be as many as 20% who suffer from heartburn 2 or 3 times a week. This is a problem, and this is the problem that needs to be focused on.
Is this a difficult surgery? And first, if we can just explain the esophagus. That's just where food and liquid is actually taken from your throat to your stomach, for those out there who are unaware of that.
Correct. The esophagus is a muscular tube which connects the throat and the mouth with the stomach. It functions through gravity, but also it's got a little bit of muscular function that helps propel food from the mouth down into the stomach. But other than that, it doesn't really serve much other purpose. However, it is one of the first areas that becomes affected by a common condition we call gastroesophageal reflux disease. And that's a condition where acid or contents from the stomach abnormally comes into the esophagus. Now, many people experience that. However, some people experience it much more often than others, to the order of 2, 3, 4 times a day, sometimes multiple times a day and every day of the week.
And Dr. Baines, is this a difficult surgery once you're diagnosed?
Yes, it is a more complicated and involved surgery. I'm not sure I should say difficult when you're doing it often enough, but it is an operation that does carry very significant risk factors. About half of the patients will have some degree of complication, and about 10%. These complications can be quite severe. And
what kind of complications are you talking about?
Most commonly, it is complications related to the lung, infections, pneumonias, where patients are unable to cough, get rid of the secretions, and they get infections in the lung. The second more serious complication is where we hook up the stomach and the food pipe or the esophagus. If that doesn't heal properly, there's a leakage of secretions from the mouth, esophagus into the chest cavity that can lead to some serious infections.
And Bart, what was it like for you once you realized that you had to undergo surgery?
In talking to Dr. Baines, he drew an outline of his stomach and an esophagus, and he told me exactly what he was going to do. And it was frightening to hear that 2/3 of my esophagus was going to be taken out and 1/3 of my stomach, and the remaining part of my stomach stretched up to attach to the remaining part of my esophagus. And I said, what's the effects after all of that? And he says, you'll be normal. And I kind of thought twice about that, thinking, how could that be?
How is that possible?
Exactly. But here I am, and it is. There's just, food intake and sleeping have to be regulated somewhat because your stomach is smaller, and because they take out the valve that controls the food that's in your stomach, you effectively have to sleep on like a 30-degree angle. But really, that's a small price to pay to be still around.
And you look fantastic.
Thank you.
You look great. So you feel normal again?
Yes. And it's a different kind of normal in the sense of the eating and the sleeping. But other than those 2 points, everything else is normal.
Okay, fantastic. Well, we'll be right back with more information on esophageal cancer and things you can do by way of prevention. We'll be right back. Jersey Viewpoint, I'm Sade Bedarenwa. Like most cancers, esophageal cancer is best fought with early detection. And with us again from Memorial Sloan Kettering Cancer Center are Dr. Hans Gerdes and Majid Baines and Bart Frazzitta, who was diagnosed 4 years ago. And Bart, we were talking about your recovery during the break. Walk us through what it was like for you when you were going through your chemotherapy.
Started chemotherapy in February of 2000. Chemo that I had was a combination of cisplatin and Taxol, and those 2 drugs were infused through a pump which I carried around with me for 24 hours a day for 5 days a week. So I was taking chemo that period of time for a 6-week period. So it was 24 hours a day, 5 days a week for 6 weeks. While I was taking chemo, I was also taking radiation for that same 6-week period. Today at Memorial Sloan Kettering, the protocols that they use are different. more, as I like to call, patient-friendly, in that you don't have that kind of extensions in most cases that I've come to know.
And Dr. Baines, if you can elaborate that on what is being used now to actually cure esophageal cancer.
Yeah. Before I get into that, I think one needs to address the issue of at what stage do we use the chemotherapy and radiation therapy. We are selecting patients with locally advanced disease for treatment with chemotherapy and radiation therapy. When patients are detected early, they do not benefit from chemotherapy and radiation therapy. The chemotherapy at this time is a different combination which is given
really depending how advanced the stage is.
Correct. But also it is started depending on how much of symptoms are there in difficulty in swallowing. If a patient is having a lot of difficulty in swallowing, he will get a course of chemotherapy, wait for about 3 weeks, get a second course of chemotherapy, and start with the radiation therapy, and then on weekly chemotherapy that will go on for about 6 weeks. We wait for about 4 or 6 weeks and then consider surgery. At this time, as Bart was saying, that patients do tolerate chemotherapy much better, and maybe they will miss their work on the days they are getting the chemotherapy, but otherwise they feel well enough that they can continue working on a regular basis.
And Dr. Gerdes, can most survivors live a normal life that we see right here?
I think so, and I think as Mr. Frazzitta mentioned, he has adapted his life with some minor changes in how he eats and the position of his bed, but he can go on and live a normal life.
And there are some people who may be actually suffering from this right now. Are there any clinical trials going on right now that you're aware of that people can be a part of?
Well, there are multiple clinical trials that are always ongoing. Our center in particular has been focusing on methods of better staging the cancer, in particular using radiographic techniques involving either CAT scanning or PET scanning, endoscopic techniques such as endoscopic ultrasonography, and surgical techniques such as laparoscopy to stage these types of cancers, and based on the staging to determine the most appropriate therapy for the patient.
You know, we hear about when you get at a certain age that men maybe need to check for colon cancer, or is this something that when you reach a certain age that everyone should be checked for, or really just look at these early warning signs?
I don't think so. I think the incidence in the United States is really not that high to warrant screening general populations. But what is important is for individuals to identify whether or not they are at high risk. And the main risk factors for esophageal cancer in the United States are chronic acid reflux, chronic heartburn, and this is often associated with obesity, smoking, consumption of alcohol. And individuals who can identify themselves as having some of these factors can present themselves to their physicians and be evaluated based on their symptoms.
And what has it been like for you? Has this changed you at all?
To a great extent, yes. The sense of wanting to give something back to Memorial Sloan Kettering, to Dr. Baines, Dr. Gerdes. My wife and I decided to create something called the Esophageal Cancer Education Foundation. And the purpose and the mission of that foundation is really to make people aware of this disease, both from the public point of view as well as from the medical community point of view. I think so many times we listen to ads on TV about different kinds of drugs that will cure any kind of heartburn that we're having, and occasionally I think that's good, but I think we tend to treat it as not a very serious thing. I think if you have chronic heartburn, as Dr. Gerdes has said, you need to have that looked at by a doctor. And in reality, the endoscope is probably the one significant test that you can take that would clear up any issues as to whether you have esophageal cancer or not. Dr. Baines and Dr. Gerdes are both correct in that you can't treat, or you can't have a common type of test for people over 40 or over 50 or whatever the case may be. But certainly it's an area that needs consideration. I kind of a little bit different than Dr. Gerdes on this, in that an endoscope is done by the same people who do colonoscopies. So effectively, in my mind anyway, and Dr. Gerdes did this for me in January, he gave me a colonoscopy as well as an endoscope. and you're doing it at the same time, under the same anesthetic, in the same hospital. And I would like to see somewhere down the line that the two get merged into the corporate America as to one test, accomplishing both things.
And since you started this organization, what have you found a lot of people have said to you after finding out they were diagnosed with the disease?
Amazed. Shocked that it could happen. A lot of them have chronic heartburn, have treated it with taking the local antacids and then subsequently gone to the prescription antacids. It just seems we need to focus as a community on these antacids and what they do. And are they prescriptions that we should take from day one and never go back to a doctor and just continue to take them, or should we take them for a period of time, stop them, if we still have the antacid or the heartburn, go back and see the doctor again? Because as Dr. Gerdes said, the distance between the people dying and the people that are finding this out is so close because we hear about it so late. And keeping drugs coming into you to cloud the issue or hide the issue are just things that will effectively be damaging to you as time goes on.
Well, gentlemen, thank you for joining us today, and hopefully this information will get out to the right people today. Thank you again.
Thank you.
And for more information regarding all the organizations and guests featured on Viewpoint, do visit us at 7online.com, and we'll be right back with some great programs in Middlesex County that have been very helpful to homeless veterans.